Welcome to Patients at Risk, a discussion of the dangers that patients face when physicians are replaced with non-physician practitioners. Today, I'm joined by two women physicians to discuss some of the issues that women face regarding scope of practice. I don't know if you saw this or not, but I'm going to put up the screenshot, but there is a nurse practitioner that she made a TikTok video, and she says, so she has a badge and it says doctor, and the TikTok video is like, oh, nurse practitioners aren't real doctors. And she's holding her badge and it says doctor. And she posted that we need to fight the patriarchy. And she said, here's your reminder. Nurses are doctors. Occupational therapists are doctors. Pharmacists are doctors, etc. You don't need to be a man with an MD or DO to be called doctor. If you perpetuate selective title use, you perpetuate the patriarchy. What are your thoughts on that?
So working in the hospital setting, I have been mistaken from anywhere from a nurse to a social worker to someone who's cleaning up. I had one rotation where I had an intern who was taller than me, white male intern who was taller than me. And the parents kept asking him the question. And the poor thing was just like, I don't know, Dr. Patel, Dr. Patel. And we worked so hard to be physician women in medicine. And you know what? If you want to have the word doctor, okay, I'm tired of fighting that fight because everybody and their mama are going to be doctors. And I realize it is also, but I'm going to be a physician. I'm going to be proud that I am a female physician. And I want to be recognized as a female physician. There's nothing against nurses. There's nothing against social workers and that thing, but that's what I did. That's my accomplishment. Please don't take that away from what I did, and recognize what my title is.
But don't you see that happen? I wrote a big post. I actually put it on my personal Facebook. I was kind of fired up about Women's Physicians Day because I think it was Kansas, the hospital that said on Women Physician Day, we would like to recognize all of our women providers. And it was really tone deaf. And I was really angry about it because I said, this is really disrespectful to the work that women put in and the glass ceiling that we've had to break and the sexism that we've faced and the discrimination and the role strain and all these things. And then just to say, well, you're just the same as somebody who did it in a shorter time. And so I wrote that and then I made it public because people asked me to share it because they liked it. And so because it was public, then people start weighing in that I don't know, including a lot of nurse practitioners. And they were angry at me. And they said, what you say is fine, but why do you have to denigrate other professionals to lift yourself up?
But it's not denigrating, right? It is recognizing that this is the title that I've earned. I'm not taking away from nurse practitioners. I'm not taking away from what you've earned. You have you get a whole week with nurses. You celebrate yourself then you have a whole week with your own nurse practitioner part of it. It's one day for women's physicians. It's honoring Dr. Blackwell on that day. She is a woman physician. So I that's it. It's just like, it's one day, people.
Go through your training, be proud of what you did. Like if I was an MP, I'd be proud of what I did. Say I'm an MP. I am not an MD. I'm not a doctor. I will still fight, the title because I think it's ridiculous. And there's a reason why we go to school for 11 years, whether you're male or female.
It's not taking away from anyone.
Right,
it's not
at
saying
all.
That. And we have National Physicians Day, by the way, that I think it happens in April or something like that. But it's not taking away from, and I loved what you say, just be proud of what you became.
Yeah.
Like, just be proud of that. Like, why is it so hard?
There's a little part of me of the jealousy of like, and I didn't get to talk about that more too, is that I wanted more kids. And I'm in that time where my fertility is probably jacked and I'd be crazy to do it on my own, like a single mom, have a baby on my own. But I've thought about that. I almost wish I did that route because I would not be $200,000 in debt. I would have kids. I would not be old and tired and being a grandma when I'm like 80, so there are things that but it's so appealing. So
I think the point of it is, and one of the reasons why women physicians did get so fired up about this is the fact is we had to
sacrifice.
make some really hard choices. And in many cases, it did mean deferring, delaying, or potentially not being able to have children or even meet the right person. Because you remember how difficult dating was in medical school and residency. And so a lot of us decided that we were going to make that sacrifice. And there is no part-time medical school. There is no
Right.
flexible work while you go to school, medical school. There's none of this. Whereas to be a nurse practitioner or even a PA, there are routes that allow that flexibility, but for physician, there's not. Now, one of the things that some women physicians weighed in that said, well, maybe there should be. I don't know that I agree with that, just because maybe you could have kids and then go back. I mean, what are your thoughts on that?
Two things. First of all, training matters. It's just evident, right? Secondly, we women physicians, we are kind of aware of the sacrifices that we're going to, and we are choosing that. And we're not doing this podcast to be like, cry me a river, like, wow, look at me type of deal. But it's for this understanding that we made those choices. We know what it's going to take to do that. And I'm sorry if you didn't realize the sacrifices that medicine actually has, or somebody didn't tell you. But the podcast is not to be like, oh, look at me, you need to like feel bad for me. It's like, no, these are the choices that we have made, and we know we're making these choices over and over again. And we just want people to be aware of that. That's why we need a female women physician day, to celebrate the choices that we have decided to make.
Yeah, I think recognizing that sacrifice. And I think that's why women do get so frustrated and even angry when someone says, well, yeah, but you didn't have to do all that. It wasn't worth, you could have just taken this other path. And the answer is no, we couldn't, because to become a physician, you have to take these steps. You have to do this training, because that's what it takes to be able to independently take care of patients safely.
There's no shortcut. I actually thought I needed more training. You know what I mean? Like, but that's what makes doctors humble. When shit hits the fan, like nobody knows what it's like balancing 60 NICU babies, and you're on call and you're running and people are dying left and right and do that. So like, they're never going to understand that. Right. And so I was like, I could always use more training. We thirst for knowledge. Right. But I also think I personally think it's a calling. I don't think it's just a job. Right. It is a calling to heal others. If it was easy, everyone would do it. Things that I honestly, you think back, you're like, okay, the Krebs cycle, everything is MCAT, the Krebs cycle, all this stuff is, I don't even use it to this day, but there's a reason why we go through that, right? There's a reason for the studying, the critical thinking, the analysis, that's all part of what makes doctors, because we are able to do these things that other people can't. Otherwise, everyone would be a doctor, right? So it's a very special thing that we go through. So when you have other professions that say that they dumb it down, is just such a slap in the face of what we go through to be where we are. And again, like I said, we make it, I can walk in the room and I'm analyzing from head to toe from when I first in there, and we make it look easy, but that's called the 11 years of training that I've done. Right. And unfortunately, there's no simple thing in medicine, in my opinion. I remember working in the ER and I had an MP come up to me and say, hey, Dr. Hanna, I can't get a good look at the ears. Can you just double check? So, and I go into the room and the girl's like Kusamal breathing. Like she can't even breathe. And she's like having, she can't breathe. And I go, I'm not worried about the ear. Do you not see how she's breathing? And that was the one patient she came and got me for. So imagine all the patients that I didn't see. And I have a panic attack every single day when I was working in that mindset. And it's not fair to the patients. It's not fair to them. It's not fair to anyone. And the problem is the administration and healthcare and insurance. And it's like, I don't know how to fix it. And it's very, very frustrating.
The profit-driven system, and the idea by administrators that, like you said, because you're good at what you do, because you've done it for so long and you've worked so hard to achieve your skills, it does look easy to an observer who just says, well, somebody else should be able to do that. They don't realize what it took to get to that point.
To kind of go on your training too, like I remember when I was being trained, it's like you have to go into an ER. That's how they explained it to us. And you have to look at those 16, 17 patients, and you've got to figure out right then, there in the spot, which one needs your attention, which can be a level 1, whatever it is. But that's how you're trained. You're trained to walk into a situation and be like, okay, this is not right. And sometimes people think it's like a gut thing, but it's really all these years of trainings. Yeah. And then you walk in, you're like, okay, you don't, or there's something that's nagging you about it. And one thing with medicine is like, you take your patients home, you take them, you're just like, you don't stop thinking about them.
So when you mentioned that, we are trained to walk in and take control of a room, does that also become a problem when women are perceived as being, quote, bossy, bitchy, things that men doctors often are not labeled as, when you're really just going in there and taking control to take care of patients?
I just always look at it like I can deal with that afterwards. Like, I'm not going to deal with that right here and there. You can do whatever you need from me. And then I think with everyone's track record, people know how you are, type of deal. But I remember someone complaining about me, another nurse, that I blatantly walked into the C-section and it was in the OR and I was being all valiant and blah, blah, blah. And then my director was like, this doesn't even sound like you. I don't even know what you're talking about. And you're just like, wait, I saved that baby. Like, what are you talking about?
That was what I was talking about earlier, is like, not for some reason, women nurses, and I don't want to generalize, but like, I've seen them do that to female physicians all the time. And I'm like, and the same thing that you just said, like, I'm 5 feet tall and working in the ER. And if I have paramedics that come in, I get challenged every day. And it's frustrating because I know you don't do that to my male colleagues. Right. But
that happened to me the other day. I called 911 for a patient that was orthostatic. It's an adult, but she was really unwell. But looking at her just sitting there without having the vitals and things like that, you might not know. But, I assessed her and she needed to go to the emergency room. Right. So I called, and the EMS people, a troop of guys came through, and the first group was very nice. And then the second group, I guess it was the in charge guy. And he looked at her and he said, she looks just fine. There doesn't look like anything wrong with her.
And you're like,
and I said, well, and what bothered me was, I've been doing this for 20 years and I found myself questioning myself. I actually stopped for a minute and said, well, maybe I'm wrong. And then I said, well, she's orthostatic and check. And he's like, well, I don't believe it. And so he started taking her vitals. And of course it turned out that I was right, but I was actually really upset at myself that actually made me stop for a minute and second guess. Have you ever felt that way?
Absolutely. Absolutely. I feel that way. I'm just like, they come in and then you go like, did I do the right thing for that kid? Like, this has happened a few times with me. And I'm like, you know what? No, obviously I saw the kid, I took care of this. That's why they looked better by the time they got there. Right. And then I'm having, I'm 5 feet, I have 5 tall fire, people walking in, and it looks all intimidating. And especially when they say that in front of the patient.
I actually warned the patient ahead of time. I said, I'm just going to let you know that a bunch of people are going to come in and most likely they're going to challenge me, because this has happened so many times. And so everything went well, but it was interesting.
Yeah. I wish we could change that. I appreciate our local 911 and all them and stuff like that. But it's just very frustrating because I feel like I've not seen them do that to my male colleagues. In the 20 years I've done this, I just don't feel like I see them do that
I think you're probably right.
Okay. So for the women physicians, especially the ones that are coming up, I have the privilege of teaching a lot at the DO school here locally. So I get to see them. First of all, what you're doing is amazing. Okay. Like it's just amazing. We recognize the sacrifices. We recognize what you're kind of going through, and we're going to still fight for you. We're going to fight for you but you have to fight for yourself too. And that's how change is going to happen. And that's how you're going to be like, no, I X, Y, and Z. And so when I talk to them openly about my own experiences, then it's like, oh, you can have kids and a husband who is a trauma ortho, and how does that work, and the advices that I've given. So first, that would my piece of advice: just be proud of who you are, and you're going to have all these battles, but we're right here behind you because we're continuing to battle for you and with you.
I hope more and more women go into medicine and don't give up. We need every day, when even in my clinic, and I have cute little girls that just like, and they're like, oh, I love that. And I'm like, I say it every day. We need more female doctors. You can do it. You can put your mind to anything. And as a single mom, pediatrician, minority, family from an immigrant, if I can do it, anyone can do it, and so don't ever give up. Don't ever let anyone tell you that you can't do it. And it's okay to be a good mom and a good doctor. You can do both. I promise.
Absolutely. Absolutely. Although, realizing that we can't be perfect at everything.
Right.
And it's okay to forgive yourself for not being all things to all people and being perfect in every way. We're just all doing the best that we can every day.
I'm raising 4 boys, and I want them to know that mommy can be a physician, daddy can be a physician, and this is how it works. So when they have their spouses, whoever their spouses are, they recognize that it's a balance at home to support each other. And that's why I keep doing what I'm doing. I'm raising 4 boys, and I want them to see that it's not, mommy doesn't cook all the time. Dad does it too, like little things like that.
Because we need men to be our allies.
Yes.
And that was one of the things I was so proud because on that post that I was telling you about, I did on my Facebook page, quite a few men physicians weighed in and said, thank you. We recognize you. And it meant a lot to me. Yeah. So I am also talking to our men physician allies out there. We thank you for helping us to be able to do the best that we can do, because we need your help and your advocacy.
I just wanted to take this moment to be like, kudos and thank you for putting yourself out there. I know it's so hard to
you're my hero.
all the vitriol and stuff like that, and I don't know how you do it every day.
It helps to have all these strong advocates out there and all the people that are kind of like rooting for this to work, and we know what the stakes are, right? I mean, we're all going to be patient, so this is so important. We have to fight for it.
And I do think some people are afraid to also speak up. I was afraid to lose my job about certain things.
Well, it's a legitimate fear, because people do lose their jobs. I'm very lucky that I'm self-employed, so I can say whatever I want to, pretty much.
Yeah.
Thanks so much for joining us for this episode. If you'd like to learn more about this topic, please get our book, Patients at Risk: The Rise of the Nurse Practitioner and Physician Assistant in Healthcare. It's available at Amazon and at barnesandnoble.com. And if you're a physician and you'd like to join our group to advocate for physician-led care and truth and transparency among healthcare practitioners, please join us at our website, physiciansforpatientprotection.org. Thanks so much, and we'll see you on the next podcast.